This video explains wound care for burns using Greasy Gauze. Greasy Gauze is a piece of soft gauze that has been coated with a special oily or greasy substance. This greasy layer keeps the gauze from sticking to a wound, helps the wound stay moist, and makes it easier to change the dressing without hurting the healing tissue. It's often used for burns, skin grafts, or wounds where you don't want the dressing to dry out or cause pain when removed. If this product is not available, you can use gauze with a generous layer of Vaseline spread all over the surface. Do your wound care when it best fits your routine and your work schedule. If you need pain medication, take it 30 to 60 minutes before taking off the old wound covering. Gather your supplies on a clean surface with a sink nearby. You will need antibiotic ointment, Greasy Gauze, gauze and Vaseline, a variety of gauze wraps, stretchy netting, clean washcloths, and clean scissors. Wash your hands with soap and water for at least 30 seconds. Make sure to wash in between your fingers and under your fingernails. Be sure to clean your scissors with soap and water. Open the Greasy Gauze packet and place it flat on a clean surface. If it comes in a roll, cut the amount you need with clean scissors. If you don't have Greasy Gauze, you can spread a thick layer of Vaseline jelly on a large gauze pad instead. Use clean hands or a clean washed butter knife to smear antibiotic ointment on the Greasy Gauze or the gauze and Vaseline. Be sure to cover the gauze to all the edges with the antibiotic ointment. Now it is time to remove the old dressing wrap. Be sure to wash your hands again with soap and water for 20 to 30 seconds. It is important to have clean hands for all steps of wound care. Remove the dressing that is currently covering your burn. First, take off the stretchy netting. Unroll the white gauze layer. Gently peel off the greasy gauze layer. If the greasy gauze is stuck, apply water to loosen the dressing wrap. Clean the wound with a washcloth and mild soap. Start in the middle of the wound and wipe outward with enough pressure to remove the old drainage and ointment. If needed, rub in circles to remove the drainage. Fold the washcloth to a clean side with each wipe. Dabbing does not remove the germs. After the wound is clean, wipe the skin around the wound with a clean washcloth. Rinse the wound with clean water to get the debris off. Check for signs and symptoms of infection, which are fever, more pain, swelling, bad smell from the wound, drainage that looks milky, cloudy, or discolored, and redness spreading in the skin around the burn. If you have any of these signs or symptoms, contact your burn clinic or go to the nearest emergency room. Next, you'll see the steps to apply a fresh wound wrap. Place the greasy gauze on the wound with the antibiotic side down so the wound is fully covered. It is important that the wound does not dry out. If you don't use the whole package of greasy gauze, seal it in a clean plastic bag or foil and use it the next day. Wrap the rolled gauze around the greasy gauze to keep it in place. Not too loose and not too tight. Place the stretchy net over the gauze to keep it secure. You can cut holes in the netting so your fingers or toes fit through. If the wound is on your torso, use a gauze pad to hold the greasy gauze in place. Measure your stretchy netting to fit the torso and cut where necessary. Cut holes for arms near the top of the netting. With help, stretch the netting to fit the torso. Place both arms in the armholes. Put the netting around the head. Pull the netting down onto the torso and be sure that the greasy gauze stays in place. If the wound is on your leg, you will need to cut the stretchy netting like a pant. Cut a hole near the top for the good leg. Stretch out the top part to fit the waist. Roll up the netting to be put on the leg. Put the shorter side on the leg that is not burned, and the longer netting on the leg that is burned. Pull up the pants. With the hole in place, you will be able to go to the bathroom and not need to take these off. Keeping your wound covered with clean and dry dressings helps your burn heal. If your wrap becomes dirty or gets wet by accident, you will need to do wound care again. Stop using the greasy gauze and ointment when the wound looks pink, dry, and is no longer draining fluid. You can then transition to an unscented lotion for skincare. Burn wounds can be painful, but with treatment and care, your body can heal.